Hi, my name is Lynn Nelson, MD. I specialize in the treatment of cervical spine, which is neck problems, or lumbar spine, which are low back problems.
I am Monique Bailey. Everybody calls me Mo. I am a nurse practitioner. I work with Dr. Nelson in the clinic and doing surgeries.
I have a really great family. My wife Julie and I have been married for, get this, 40 years now. We have 3 boys who are now 33, 31, and 29, and a bonus baby girl who's 22 years old. We're an active family. We enjoy outdoor sports, particularly water skiing. We snow ski as well. We really enjoy each other's company.
And I am married to my husband Kevin. We have 3 children. Our oldest son, he's a police officer. Our daughter works right here in Chicago, and our youngest son is going back to graduate school for clinical psychology.
I grew up on a farm 20 miles straight west of Belmont. My father was a very hard-working, salt-of-the-earth farmer, row crop farm with hogs and cattle on the side. Over the years, I continued to farm in that I had that land share farmed with a very good tenant. 3 years ago, I began farming it myself with my own equipment with the great help of a very good hired man. My education after high school included completing an undergraduate degree at Buena Vista College in Storm Lake, Iowa. I then completed a 4-year standard medical school training program at the University of Iowa, graduating with an MD, of course. I then completed a 5-year orthopedic residency at Indiana University, which is in Indianapolis. After residency, completed a spine fellowship at Kansas University in Kansas City, Kansas. I then practiced for 27.5 years with Des Moines orthopedic surgeons in West Des Moines. I began full-time here at Iowa Specialty Hospitals in January of 2022.
I received my ADN at Iowa Central in Fort Dodge. I then practiced and worked in the ICU for 10 years before coming to Iowa Specialty Hospital. Worked in the PACU for 10 years. After that, received my bachelor's and master's degree from Briarcliff University, and then started with Dr. Nelson.
During medical school, I found orthopedics to be by far the coolest specialty. We could effect improvement in patients' lives, patients of all ages' lives, in a very short period of time. Very gratifying specialty. I was drawn to spine largely based on my father's spine problems. He was, unfortunately, by any definition, a failed back patient. He had 5 lumbar spine or low back surgeries in his lifetime and 1 cervical spine procedure. Some of the surgeries were a benefit, and unfortunately some were not. Observing his clinical course and its effect on his life prompted my interest in spine surgery.
Well, I've always wanted to be in nursing. I decided to advance my degree. I always wanted to stay in the surgery department, so when the opportunity arose, I got to work with Dr. Nelson, then I took that opportunity.
I'm pleased to have the opportunity to see patients in Des Moines. I have a huge number of both surgical and non-surgical patients. Those patients, in most cases, were happy with their care and trusted me to provide the care that they needed. And they also would like the opportunity to have me see and take care of their friends, relatives, family members, whatever the case may be, who have spine problems. I see those patients at the Iowa Specialty Hospital's Iowa Weight Loss Center. It's a beautiful, newly remodeled building at 5901 Thornton, which is just southeast of 63rd and Park in Des Moines proper. Patients seen in Des Moines typically are referred by their medical provider. I prefer that those patients have diagnostic studies done prior to seeing me so that visit can be more productive. Those diagnostic studies typically include lumbar spine plane x-rays, most commonly an MRI scan, but in some cases a CT scan. Patients presenting to my office are typically seen initially by Mo. Mo can describe her role there.
I usually take the history and physical and then Dr. Nelson comes in and does the radiology reports and comes up with their plan.
Right. Clarify parts of the history and the physical examination, and as Mo said, review radiographic studies with those patients, and talk about how we can best accomplish their goals to treat their spine problem. My surgical practice is confined to neck or cervical spine, low back, lumbar spine procedures. In the cervical spine, the most common two procedures are an anterior cervical discectomy and fusion, which is a procedure where pressure is taken off the nerves by removing herniated disc material, bony spurring, soft tissue overgrowth, whatever the case may be. And once the nerves are decompressed, doing a fusion. A fusion means placing a implant or bone graft within the space where the disc was. In many cases, we also add a plate to hold the vertebrae still to maximize the likelihood of it fusing appropriately. The other common type of cervical or neck procedure is doing the decompression fusion as already described, and then rather than placing an interbody fusion device, we place a disc replacement device. The disc replacement device, of course, is to maintain motion of that disc space, which otherwise would be fused. The primary advantage of a total disc replacement is to preserve motion, not so much at the surgical level, but the levels above it and below it, to lessen the likelihood of progression of wear and tear type changes, again, above or below that surgically treated level. In the lumbar spine or low back, there's two commonly performed procedures in my practice. One is a decompression meaning freeing up the nerves by again removing what is impinging on those nerves, be it bony spurring, soft tissue, or disc material. In some cases, those patients also need to have the vertebrae stabilized or fused, and as in the cervical spine, that involves placing bone graft, and in most cases placing spinal instrumentation to hold those vertebrae still so that they fuse or heal more reliably. Patients understandably want to know in many cases whether they're a candidate for spinal surgical procedures or not. The best candidates in regards to good results are those patients who, with a cervical spine problem, have predominantly radicular pain, that is pain that travels down the arm that follows the nerve distribution, or in the low back, pain that follows the nerve distribution in the low back. As crazy as it may sound, a low back procedure to take pressure off nerves is better and more reliable for relief of that radicular pain down the leg than it is of low back pain, and it's similar in the cervical spine or neck. Surgical procedures generally better for relief of radicular arm pain than of axial neck pain. Patients understandably want to know what they can expect from a recovery standpoint after surgical procedures. With lumbar laminectomies to free up nerves, patients have less restrictions over time, but some restrictions for 12 weeks. Initially, those restrictions are lifting no more than 10 pounds and no repetitive twisting or bending, again lessening over time to, in most cases, a full release at 12 weeks postoperatively. Lumbar fusion patients are considerably different in that we have to allow time for the fusion to take, and that is a relatively slow biologic process. Fusion patients should not expect to be back to full activities for at least 4 months, and in some cases 6 months. Cervical spine fusion patients usually can be back to full activities in somewhere between 3 and 4 months. Cervical total disc replacement patients can usually be back to full activities in no more than 6 or 8 weeks. I'm really incredibly pleased to be back seeing patients in Des Moines. I've had a lot of demand from patients that I provide service in Des Moines again, and Iowa Specialty Hospitals via the Iowa Weight Loss Center is a very, very nice facility to accomplish that.
Iowa Specialty Hospital.